So the thing is, if we're not catching our dysplasias early, right? Some of those dogs may do well for the first year or two of life. They walk around, maybe they're not super athletic, but they do their life, right? They go for a walk 15 minutes a day, maybe 20 minutes a day. We don't see it, right? But as that cartilage starts to decay from that chronic synovitis that's going on, now we start to see limitations. Maybe the dog who's 3 can't go up the stairs easily, right? Or bunny hops up the stairs where it uses both legs together. They're then coming in, right? Now we're trying to figure out that we've got that arthritic joint. Historically, we looked at that and said, okay, well, you hurt, maybe we get some radiographs. We don't have a lot of surgical options for all these diseases. Right? We have some, but we still need to be working on those. And I think separate from that, we're getting better in our surgical options. Right? We can get to total hip replacements now. We have some surgical interventions for OCD lesions, of course. We have arthroscopy. But those are on a specialty level. But historically, we said, okay, well, you have pain. Well, let's take an NSAID, right? NSAIDs have been studied well. They're historically very safe. Yes, they can have adverse events. But historically, we said, hey, here's your NSAID. Go feel better, right? Maybe get on a joint supplement. Maybe lose some weight. We know that lean body mass and daily low impact exercise, no matter what species you are the 2 best treatments for osteoarthritis. But we took pills, right? Here's the pill, take a pill, take it when you need it, maybe take it every day, right? Do you need more pills? And then that joint becomes more and more worn out and we need more pills. But that was back in the day, right? We used to say, well, here's these things, because we didn't have a lot of other great opportunities. We didn't have a lot of research. As that's all changing now, we've really started to focus in the last several years about a targeted approach. Especially, right, when we only have 1 joint that's arthritic, or even 2. Right? We have other joints, the rest of the body's healthy. Right? And I like our oral meds, but if we cannot challenge them systemically, let's see if we can go through a targeted approach. Targeted approaches can be external. Right? We've had some research in the health fields of things like extracorporeal shockwave therapy, laser therapy, pulsed electromagnetic field therapy, right? Things that are still targeted, but we do externally. Some of them need sedation, some of them don't. We can do those to try to knock down the pain so that we can get better exercise. Everything's about getting that dog moving again, right? We can pull them on all the meds or targeted therapies we want, but if we don't get them to a lean body mass and walking 30 to 60 minutes a day, 5 to 7 days a week, right? We have to keep that body in motion, right? We're gonna have failures of our treatments if we don't get to those. So yeah, we then did external treatments for a while, but what have we learned, right? What can we in our small animal veterinary field learn from our colleagues? So our large animal colleagues, equine colleagues, and our human colleagues. So if we look at that One Health approach, in both humans and equine, they do a lot of targeted joint injections. Not necessarily blocks to numb stuff out, to figure out the lameness. That's part of it. But also, can we inject something directly into the problem area? Can we help to modify that microenvironment of the synovium? Can we affect that joint as an organ directly? We have different things, right? We have cortisone, we have viscosupplementation, we have what field of orthobiologics, which is platelet-rich plasma, and stem cells or bone marrow aspirate concentrate. We've learned a lot of things in the last several years. And we also have things like radiosynoviarthesis, the use of a radioisotope to change that environment, and also polyacrylamide hydrogels. And again, things that we can lean on from other species, but again, we're putting something directly in there. When we do that, we're trying to figure out what to do in the right order. Do we knock down inflammation first? Do we need to work on supporting the joint capsule more? That gets more into the details of each individual patient and what their needs are. Some of them still may need surgical intervention, but we've really now focused in the last several years on that targeted approach.